Well, I've been talking about dengue fever on the show quite a bit this year because it's a massive problem in 2019, and we've seen massive outbreaks throughout Southeast Asia, down in Latin America, and other places. Well, another place that's really got hammered with dengue fever recently is Bangladesh, and the numbers are just rising rapidly. And from this report in the Daily Star, it says dengue outbreak, experts wary of the next 3 months. And it says that they're concerned that the dengue outbreak may continue until October or until the end of November. They said that the risk would remain unless the authorities concerned, as well as the people, take all-out measures to combat the Aedes mosquitoes now. Now, the Director General of Health Services, or the DGHS, and this is where we get all our data from when we're researching the Bangladesh dengue situation. It shows that the months between July and October over the last 5 years were always in the top 3 spots in terms of reported dengue cases. In 2017, the third highest dengue cases were recorded in November, so it is possible. So there's a lot of concern there. Now let's put this into perspective. In July 2019, Bangladesh reported over 13,000 dengue fever cases in that 1 month. In that 1 month of this year, that's the highest amount compared to any year since 2000 when dengue was first recognized in Bangladesh. It's never been over 11,000 in a year. And just in July 2019, it was over 13,000, and it's still rising, as you're going to see in a moment. So, yeah, that's a real big problem going on in Bangladesh. And this is a PowerPoint, so I apologize to people listening on the podcast, but what I'm just trying to demonstrate here is this is from the Institute of Epidemiology, Disease Control and Research, or the IEDCRs, the public health arm in Bangladesh, in Dhaka. And this PowerPoint was actually made on July 24th. And you could see, and I'm using the mouse, that on July 24th, there was over 6,400 dengue cases in July. Way more than the 1,829 that were reported in all of June. And we have 6 years right here, and you can see this peak here in September of 2018, a hair over 3,000 cases. Prior to July 2019, that was the most dengue cases ever recorded in a month. Far eclipsed it since then. And I apologize, there's not a more current PowerPoint, but you get the point what's going on there. And when I started following the dengue stuff, it was just a handful of districts. Maybe about a week ago, there was about 50 districts that were affected by dengue in Bangladesh. Well, this report out of The Independent, another Bangladeshi news source, says the dengue has spread to all 64 districts. And let's see what this report has to say. It's got some really important data in it. The government yesterday confirmed that dengue has spread to all corners of Bangladesh, indicating that the situation has taken a turn for the worse. Quote, "We can say without a doubt that there's dengue patients in all 64 districts," Directorate General of Health Services, Health Emergency Operations Center's Control Room Dr. Borhan said. The dengue situation worsened as nearly 1,700 people were infected by the mosquito-borne disease, got admitted to hospitals across the country yesterday, August 2nd. Now, according to DGHS data, till date, there's been at least 21,235 dengue cases. All right. Remember, I just showed you that that PowerPoint chart, and there was, the 6,000 or so in up to July 24. There was about 1,800 in all of June 2019, and then a smattering of some other cases. So there was less than 10,000 at the time. So look how much the numbers have really risen over such a short span of time. So far, according to government data, 14 people have died of dengue. But there's reports all over the place saying that number is much, much higher. In fact, this report does say, analyzing different media reports and talking to government and private hospital authorities in the city, in Dhaka, the independent learned that with yesterday's deaths, the number of people who have died after being diagnosed with the disease has risen to 42. I've seen some numbers higher than that, some lower, and of course the government numbers are by far the lowest. But it's a massive problem, and there's a lot of question on whether Bangladesh is handling this very well. Now, this was a report put out at the beginning of the year, before the outbreak even started, by people from the IEDCR and the Department of Virology and other authorities in Bangladesh. And this is really about the serotypes that are circulating. In a sense, it says, since 2000, Bangladesh has been experiencing episodes of dengue fever in every year. All 4 serotypes have been detected with dengue virus 3 predominance until 2002. After that, no dengue 3 or dengue 4 was reported from Bangladesh. The IEDCR, under the Ministry of Health and Family Welfare, a mandated organization for outbreak investigation and surveillance in the country, found dengue virus 1 and dengue virus 2 in circulation from 2013 to 2016, and predicted that because serotypes dengue virus 3 and dengue virus 4 are circulating in neighboring countries, they may create epidemics of secondary dengue in the near future. Then in 2017, a reemergence of dengue virus 3 was identified. Subsequently, there was a sharp rise in dengue cases from the beginning of the monsoon season in 2018. With the expansion of the outbreak, more dengue cases with deaths were also reported compared to the last 15 years. So, yeah, we have, and that's part of the problem with dengue fever. You have these 4, and there's a 5th strain that's been reported. And infected with one strain, you get a kind of milder type of infection. Very little, you get immunity to that strain, very little immunity to the other strains. Then if you get a second strain, this is where you get the serious dengue hemorrhagic fever and dengue shock syndrome, very life-threatening type conditions. Now, the people in Bangladesh are not happy, and this report is actually about a week old now, but it says dengue outbreak, effigies of the health minister and the Dhaka mayors burnt at Dhaka University. And it says a platform of students at Dhaka University today burnt effigies of the health minister and the mayors of Dhaka South and North city corporations, demanding the resignation over the failure in controlling dengue outbreak in the capital and across the country. So they were doing this, and I'll show you a short clip just so you can see what was going on, very short. Yeah, so that's what's going on at that university, and then there's another university, and I don't even think I can pronounce it, but I'll try. Jahangirnagar University, another one where they had lots of protests going on concerning dengue fever. And again, like I said, people are not happy with how the government and health officials are handling the massive outbreak that's going on in the country. Now, it's also become quite the political situation. And in this report from the Daily Star says Bangladesh set an example of failure in dengue prevention. And Nagoric Oikia, and I don't know Bangladesh politics very well, but this is one of the political parties, political groups that are in the country, says this group slammed the government's negligence in preventing the dengue outbreak easing the sufferings of flood-affected people, stopping rape, and food adulteration. So they're blasting the government for a whole bunch of different situations. But dengue, of course, is the monster problem right now. Quote, all districts of the country are currently gripped by dengue fever, and the death toll has risen alarmingly. But the health minister and both mayors of the Dhaka city corporations are deceiving people without taking any effective measures against mosquitoes, said the party convener Mahmudura Rahman Mana. A lot of hard names to say in this presentation. And speaking at a press conference in the capital's Jitaya Press Club, he claimed that the insecticides currently being used to kill mosquitoes is not effective. Quote, ineffective insecticide has been bought only to provide unfair privileges to a company, though various newspapers in the last 2 to 3 years published reports about it, he said, adding that the authorities concerned are yet to import effective insecticide. So they're saying that the anti-mosquito insecticides are not effective, not working. That's what I'm getting out of that. So anyway, yeah, so there's a lot of political turmoil, swirling around within this dengue outbreak too. MANA demanded free treatment for dengue patients and regular anti-mosquito operations in every union across the country. And he goes on and on. So, yeah, big problem politically also. And that's unfortunate, but that's where it stands right now in Bangladesh. And lastly, I mean, much like with, I've reported on the podcast and on the website about Venezuela and how their different outbreaks, epidemics going on in their country are spreading to their neighbors like Brazil and Colombia. Well, this report from the Daily Star says the outbreak in Bangladesh behind the rise in dengue cases in West Bengal. West Bengal, of course, is a state that borders Bangladesh, West Bengal, India. So, and it says, the rise in cases of dengue fever in West Bengal in the border regions is a result of the widespread outbreak of disease in Bangladesh, said the West Bengal Chief Minister Mamata Banerjee. The dengue situation in Bangladesh is very alarming. As Bangladesh is our neighbor, if something happens there, the effects also cross the border. So, yeah, so it's spreading to their neighbors. A lot of problems. Dengue is multiplying exponentially, it seems like, and they're not really getting a good grip on it as of today. So, and there's fears that this thing can go on for months, as I showed you in one of the first reports. Anyway, another dengue situation. Remember, this was one of the World Health Organization's 10 biggest health concerns in 2019 was dengue fever, and sure enough, it has become that. Okay, hope you enjoyed the show. Go ahead and comment below, like the video, please share it with your friends, and of course, subscribe to the channel. And I'll see you next time.